Ability of cardiac 3D printing in neonatal mitral valve repair by Mattia, Jonathan Plasencia, A.Velez, Wayne Franklin, and Christopher Lindblade. As an introduction, mitral valve repair can be challenging because of both the unique pathologic morphology of a dysplastic mitral valve as well as the limited ability to visualize surrounding anatomy by standard echocardiography. Here we discuss the various cardiac imaging modalities and their benefits through a rare case of severe left atrial dilation due to mitral valve dysplasia. For the case presentation, we begin with a full-term newborn female who failed her congenital heart screen and had an echocardiogram which revealed severely dysplastic mitral valve leaflets resulting in mitral regurgitation and severe left atrial enlargement. On the second day of life, she developed cardiogenic shock secondary to poor cardiac output that resulted in necrotizing enterocolitis and multi-organ system failure. She was intubated, started on milrinone and epinephrine, and transferred to a tertiary care center. Computed tomographic angiography highlighted severely aneurysmal left atrium that spanned 41 centimeters craniocaudally, with signs of bilateral ventricular volume overload. This is shown in figure 1b. Echocardiogram demonstrated a dilated mitral valve annulus that had a z-score of plus 9.6. We then evaluated treatment options, which included medical management, transcatheter valve implantation, and surgical mitral valve repair. A multidisciplinary team assessed the case and ultimately preferred a surgical repair, which circumvented the need for a prosthetic valve or anticoagulation. An echocardiogram and CT 3D reconstruction was limited in determining feasibility of feasible surgical repair because the degree of atrial dilation distorted typical landmarks and rotated the axis of the heart superiorly and rightward. Additionally, surgical planning required improved visualization of the pulmonary venous connection to the left atrium to determine the extent of left atrial wall resection. Therefore, 3D printing was performed to provide a more thorough anatomical assessment. This is shown in figure 2 as a sagittal view of the myocardium. This print allowed the surgical team to determine a safe approach via Sondergaard's groove, which is the yellow line in figure 1a. This also allowed for a region of tissue excision that would maintain the integrity of the pulmonary vein insertion sites. Surgical mitral valve repair and commissuroplasty of both leaflets was performed, as well as extensive reduction atrioplasty of the left atrium. Intraoperative transesophageal echocardiogram demonstrated successful repair of the mitral valve with significant improvement of mitral regurgitation from severe to trivial. Examining the clinical impact of our case, we look at the strengths of differing imaging modalities. Routinely, preoperative standard echocardiography can show things such as heart structure, function, and valves. However, there are multiple different types of cardiac imaging modalities that provide additional valuable information. CTAs are generally preferred to visualize the great vessels, coronary arteries, and extracardiac structures. 3D echocardiography allows for improved evaluation of the valve leaflets and function, while cardiac MRIs allow for better evaluation of heart chamber volumes, such as volume of flow to the body and lungs, which is your QP to QS ratio. Our case demonstrates the role for 3D printing, which can allow for better evaluation of left atrial landmarks and mitral valve morphology that can assist with the intricacies of detailed surgical planning.